Okay, so here's a problem. You go to a plastic surgeon because there's something about your eyes or your face or your body that you just want to look a little bit different, and you're asking for a solution. So the surgeon proposes a type of surgery, and the number one question I get when I propose a surgery to somebody is that surgery actually gonna work for me? And how am I gonna look afterwards? Most of us, what we do is we take before and after photos of other patients, and we show you what you would look like with a very similar surgery. But how cool would it be if you could do before and after photos of yourself before you've even had the surgery? That's where AI might be able to help us in the field of plastic surgery to kind of predict some of these outcomes. So a study recently looked at this in PRS. They looked at patients who were getting a lip lift procedure. So a lip lift procedure is a procedure to kind of improve the appearance of the upper lip by taking some skin right under the nose to hide the scar and give a little bit more of the vermilion or the red part of the lip showing. So in this study, Dr. Wolk and his colleagues took pictures of patients who were going to have a lip lift procedure, uploaded those photos into ChatGPT and asked it, can you make these lips look a little bit better but natural appearing? And it took several prompts to get them to figure out exactly how to get something that looked natural. Then they compared the photo that ChatGPT or the AI generated, and they compared it against the photos of the actual patients after they had surgery to see how accurate the AI was at predicting what it would look like after surgery. So really interesting study idea, and it would be so cool if we could use this in our own practices to kind of show you before you have the surgery what you might look like afterwards instead of showing you a picture of somebody else. Unfortunately, two problems with the study. So number one, this is the actual surgeon putting the prompts in, and it took the surgeons 3 or 4 tries just to get the correct prompt into the AI to be able to get a realistic looking image. Second problem with this study is that it actually underestimated how good of a result the surgeon was able to get. So basically, in the AI generated image, the lip lift looked kind of a little bit different than the before picture. In the actual image of the patient after the real surgery, the lips looked more dramatically different. So the AI actually was a little bit more conservative and underestimated the result of the surgery, which actually is not that helpful. If it were to give a more accurate result, we'd have a better idea of what it would actually look like after surgery. Bottom line, I don't think this is ready for prime time yet, but stay tuned because I think the idea of using AI in plastic surgery to help predict outcomes and give reassurance about what it would look like is a super amazing idea.